Good evening, and thank you for joining us for another informative Facebook Live here on blackdoctor.org. I am Ellis Dean, your host moderator for the evening, and let's just start off like this. November is one of my favorite months of the year. It is Thanksgiving time, it's getting close to Christmas, it's that late fall. You think the air starts turning, there's a lot of good things to say about November. However, the flip side of that coin is there's some challenging times in the month of November, including it being respiratory system issues that typically pop up during this month. And so a lot of vaccines have to come out in this month. And there's some illnesses that can really impact families in a significant way if we're not prepared and we don't know what to do. And so that's why we brought this wonderful panel of experts here tonight to talk about some of those illnesses and what you can do to keep you and your family safe, and some ways to make your lives better to prevent any catastrophes from happening. So I'm going to introduce our guests. We all know that they're experts. I'm going to give you their name and their title so we can get to the meat of why you're here. So first off, we have Dr. Oliver Brooks. He is the Chief of Pediatrics at Watts Healthcare Corporations. And of course, he is no stranger to BDO. Also, we have Dr. Karita Ambrose. She is the Senior Director at U.S. Head Medical Affairs at CSO Sakaris. I think I said that right, but if I didn't, please understand my Southern tongue is not as good as it used to be. So I will apologize to the company for that. We also have Julie Caldwell. She is the Manager of Immunization Services at Walgreens. So thank you for joining us tonight, Julie. And we also have Melissa Briggs-Hagan. She is Applied Epidemiologic Studies Team Lead at CDC. I had to work hard to say that. Just like really giving me those words. Okay, thank you. And finally, this evening we have Dr. James Mancy. He's a VP of North American Medical Affairs at Moderna. So I want to say good evening and thank you all for joining us and just really taking some time out of your day to be here to talk about respiratory illnesses. So we'll start with you, Dr. Brooks. You're the veteran of the crew. Can you explain the common illnesses seen during respiratory season, such as influenza, RSV, and COVID-19?
Certainly. Respiratory season is considered more or less October through March, first of all, so let's define that. And there are three major ones that we see. That's RSV, influenza, and then the new kid on the block, COVID-19. So they're all viral illnesses that give you upper respiratory and lower respiratory symptoms. So cough, runny nose, fever, fatigue, in worst case, as it gets worse, difficulty breathing. It's difficult to distinguish one from the other, but we have ways to do that. Important aspect of this is that combined, they cause a number of hospitalizations and deaths. RSV, anywhere from 6 to 10,000 deaths, mostly among those 65 and up. COVID, 76,000 deaths in 2023. We're talking about US only. Most of those in the older age range. And influenza jumps around somewhere around 36,000. And then hospitalizations. Combining those three, you get 120,000 deaths and 750,000 hospitalizations a year. And give or take how bad the year is. So these are significant infections. They occur generally between October and March. They kill a lot of people and they put a lot of people in the hospital.
Wow. So, and as you know, we're here on blackdoctor.org. And so, with many conditions, there is a kind of a greater impact on communities of color, particularly the Black community. So how does respiratory season affect the Black community uniquely, and what factors can contribute to this impact?
So I'll make a quick comment, then obviously allow others to comment. These respiratory illnesses tend to affect people more harshly or more adversely if they have underlying conditions, certain ones that we can talk about. Just think about like a house. If there's an earthquake, if the foundation is cracked, it's more likely to fall and be destroyed versus a strong foundation, and your house can theoretically withstand that earthquake. There are many other items. I'll throw it out to the other panelists because I know that they're well versed in things like why the Black community seems to be more adversely affected.
Yeah, I'll just add that one of the things that we're going to get into over the course of this call today is prevention. And there are challenges that start with prevention. So Black people are generally less vaccinated than their white and Asian counterparts, especially pregnant people, unfortunately. And so from the very beginning of having tools to prevent this, Black people are more at risk because they don't often have those tools. And I agree with Dr. Brooks that the underlying conditions then on top of that creates the additional risk for adverse outcomes. And you put those two things together on top of sometimes challenges with access to healthcare or having trusted healthcare providers that they can feel like they can go to and get good information for. Put all of those things together, and it is really a perfect storm sometimes for people in our community.
I can reiterate that as well, both Dr. Brooks and Dr. Hagan, as far as the lower vaccination rates and then transportation issues and other social determinants of health that impact someone's ability to get to those access points for healthcare, which is why it's really great that so many of the vaccinations for these illnesses are available in pharmacies and not just having to go into the provider, but those extra business hours that are available at pharmacies seem to help a lot too, to address that access.
And if I may, I think I would reiterate what was just said. The Black community has higher rates of these chronic conditions, and when you put those into context and the incremental risk, as Dr. Brooks and Dr. Hagan mentioned, when you think about diabetes, for example, if you're a diabetic patient, you have almost between 3 and 3.5 times more risk of a, for example, COVID-related hospitalization than a population of similar age, similar circumstances without diabetes. Hypertension, almost 3.5 times, obesity twice. Now, when you risk stack all of those, your risk for a COVID-related morbidity, mortality, hospitalization in this case increases incrementally. And then it's that access to care and often the mistrust and the prevalence of misinformation and even the disinformation that's circulating, and the importance of having that trusted messenger from your community to be able to give you that guidance, to respond to your questions, and give you that confidence of accepting the recommendation and keeping safe during the respiratory season.
Yeah, you said it. I was about to say it. I was like, diabetes, hypertension, all of these things lead to, I believe it's makes you immunocompromised, right? And so that suppresses your immune system, makes you more susceptible to catching one of these illnesses. And then, as all of our panelists have reiterated, when you have a comorbid condition, it can add to exacerbating RSV, COVID, and flu. So we really have to do, I love what Dr. Hagan said about prevention, and we're going to be talking about that. And what Julie is mentioning, prevention is simple as going to your local pharmacy and getting a shot. So there's some things that we're going to be talking about throughout this program tonight and moving forward, and some conversations that you should be having with your family members as we get close to Thanksgiving in a few weeks. Those are the type of discussions I'd like to hear around the dinner table. Yeah, you can argue about sports. I'm not telling you not to do it. You can argue about sports. You can argue about the crazy uncle. That's fine too. But let's mix in some conversations about a respiratory season and getting vaccinated. So what preventative, so now we've kind of talked about that, and Dr. Hagan, you opened up the door with this. I'm going to throw this one to you. What preventative measures should be prioritized during respiratory season to protect vulnerable populations? And you both alluded to it, vulnerable populations being the elderly and children.
That's right. And so I'll start with the obvious, even though I think we'll get into this more as we go along. But vaccines are, of course, a preventative measure that are really important. And the guidelines, I hope, are simplified over the past year, where it's really that if you are over 6 months old, influenza vaccines, COVID-19 vaccines are are available to you to decrease your risk of hospitalization from either of these. RSV is a little bit more complicated in that it's population specific, but RSV, as a pediatrician, let me add in that it is the most common cause of hospitalization in infants under a year old. And so protecting babies is just a huge importance in order to improve outcomes. So the RSV vaccine can be given to pregnant women between 32 and 36 weeks, or there's a long-acting antibody, so another form of protection that can be given once the infant is born to protect them during their first RSV season as well. So that's kind of the most obvious form of protection we have. Of course, CDC does put out respiratory virus guidance, and we simplified that as much as we could last year as well, which just walks you through some of the other ways you can protect yourself. So that's good hand hygiene, washing your hands, not touching your face, your mouth, or eating with dirty hands when you're out in public, making sure that you try to go to places where there's good ventilation as opposed to kind of tight, crowded spaces with lots of people in it. And when you're going to be in places unavoidably with lots of crowded people, maybe consider wearing a mask. I actually still do that when I get on planes, especially during peak respiratory virus season. And when I go through airports, just because so many people I know get sick when they travel. And so I still do that. And people, especially with those underlying conditions and high-risk groups, should consider that. And then there's treatment. So being prepared and knowing what treatments are available, both COVID-19 and influenza have treatments that can keep you, once you get sick, from getting very sick and being hospitalized. So knowing about those treatments, talking to your doctor about how you might be able to get them if you're eligible, are all important ways that you can protect yourself and prepare for what we know is coming.
Fantastic. We're going to talk a little bit about, because you brought up that mask wearing thing, and I see fewer and fewer people wearing masks in the airports. I think I stick out.
Sometimes I'm the only one, and I will still, do it. Yeah.
Like, who's the crazy guy wearing a mask at the airports? COVID really burnt a lot of people out mentally, and we've got to figure out how to get back to this. So, no, your screen is not acting up. We do have another panelist that joined us. We had some technical difficulties. We were so happy to have her here. And this is Josephine Jean Postel. She's a pharmacist, and she's a medical science liaison for vaccines at, is it Sanofi? Because I've said it's Sanofi, right?
Sanofi.
Okay, all right, we got it right. So I think I'm 2-1 right now on the pronunciation. Very good. So welcome to tonight's broadcast, and if you, again, we're round robin, as you can see. Once we throw out the question, anybody can feel free to answer. So we're talking about vulnerable populations. And how do we keep them safe? And no one mentioned, we talked about vaccines, of course, and we talked about hand washing and mask wearing, but nobody talked about one of the things that we really, bang that drum on, particularly during the height of COVID. And that is making sure that those of us that are in that kind of healthier range, that non-vulnerable state, take care of ourselves too. Because even though we might survive, if we catch RSV or if we catch the flu, or something like that, grandma might not.
Yes.
Your cousin's little baby might not. And so
Yes.
One of the things we can do, the better things we can do to protect vulnerable populations is at making sure that we are protecting ourselves by getting vaccinated. So it's not just them going to get vaccinated, it's us as well.
Absolutely.
Well, there are clear guidelines as to who needs to get vaccinated. But for 2 of the 3 we're talking about is everyone who can crawl.
Right.
Okay, babies tend to crawl at age 6 or 7 months. So if the human being can crawl, they need a flu shot and a COVID shot. Now, importantly, for this season, okay, I also sit on the ACIP. So you mentioned one of the things to do, but one of the primary group out of CDC that makes vaccine recommendation. One of the major ones this year was recommending a second, you talk about vulnerable, a second vaccine for COVID if you are 65 and older. So that's really, really important. And for those that are immunocompromised, which is probably 3% of the population, there's a whole other set of recommendations. The main thing we got to worry about, though, you brought up, Alice, and you're talking about people getting vaccinated. There's vaccine fatigue going on right now. People are like, I'm tired of hearing about vaccines. I got a shot last year. you told me to get another shot. You told me I got the shot changed from last year to this year. Now you're saying get 2 instead of 1. So we have to just reiterate the importance of vaccination. And Dr. Hagen said it. She said it fast, and we all kind of know it, but it's crucially important. The vaccine for COVID was not developed to stop you from getting COVID. It was developed to stop you from getting in the hospital or dying, and now we're seeing it reduces the chances of long COVID. So for me, you're right. I hope I don't die. I still could. But if I get COVID, the thing I'm most worried about is long COVID. So also, if I get vaccinated, like you said, I am less likely to get it and spread it to other people. So everyone that gets vaccinated, they are helping their community, like you were implying with your statement, to slow down the spread of these particular respiratory viruses.
And Dr. Brooks, I'd like to add to that, because I think I heard it earlier about trusted messengers. And sometimes I think we have to just go back to the basics with explaining this, particularly in the Black community. This is how the immune system works. This is what you might experience. Letting them know, yep, you have diabetes, as Dr. Massey mentioned, and that puts you at higher risk. But also, too, understanding, I like to use the example, and I remember when COVID was around, and explaining to people there are side effects you get from taking ibuprofen, but it doesn't stop you from taking it when you're in pain. And so we have to just kind of communicate some of those things so people can understand, yes, you might get the disease, but it's likely to be a milder form of disease. If you didn't go to the hospital and end up, seriously on a respiratory machine or anything, then that's helping you, and that's preventing that severe disease. And a lot of times I think there's a misunderstanding, and we miss the benefits because we're so focused, well, I still got it, but did you get that sick? And so I think we have to do a better job of explaining that and explaining those benefits beyond just getting infected with the virus.
Absolutely. And if I can also interject and add on to that, for those individuals that have the underlying diseases, I mean, we're talking about COVID, but flu, we know, wreaks a lot of havoc on the major organ systems, the heart, the lungs, but also the metabolic conditions. So your patients with diabetes, your patients with heart conditions, they also need to look into getting the vaccines as well for influenza, because we're talking about COVID, but at the same time, we see a lot of hospitalizations in individuals who already have comorbid conditions, such as the ones that I just mentioned. And so it's very important that we prevent the exacerbation of the diseases that they already have, which has been seen after individuals have the flu. In 1 to 3 days after having the flu, we see 8 times the amount of increase in heart attacks or stroke, influx or dysregulation of the glucose, their blood sugar. So it's very important to communicate and educate about not just COVID, but also influenza, some of these other respiratory diseases, because we want to make sure that we're also maintaining those individuals who have underlying conditions. And that's something that may not be thought about.
I just want, one thing that's been coming to mind, and I've been saying it the last year and a half, and I feel like a broken record, but when have we normalized, and as a community, we accept tens of thousands of people dying per week during the peak of the respiratory seasons, and many thousands more hospitalizations per week. We've normalized this disease burden rather than normalizing healthy living, and vaccination is one component to healthy living. It's part of keeping yourself healthy, and to what we said earlier, when you're congregating and enjoying Thanksgiving or the holidays with your family, keeping the rest of your family safe and healthy, and helping to minimize the spread of these respiratory diseases that can have a grave impact on older adults. Now, we've spoken about the acute conditions, the increased hospitalizations, the mortality, But I think Dr. Brooks raised it earlier about long COVID, for example. And when you think about it right now, based on the Health and Human Services survey, it's about 5 to 6% of the adult population are currently experiencing an episode of long COVID. That's almost 15 to 16 million American adults right now. And the majority of those have some impact on their activities of daily living, whether it's going to work, taking care of your loved ones, cognitive impact. And now what we've heard and what we've seen in the research that's accumulating is that long COVID isn't just an issue for a burden in adults, even in pediatrics, young kids, school-age kids, adolescents. It's almost 20% to 15% of school-age kids and adolescents who have had COVID have a bout of long COVID. That's pretty impactful when you consider the cognitive impairment, the fatigue, the pain, when these kids are going to school and trying to learn and getting back into normal routine. Again, all of this is preventable with vaccination. And if we can just normalize that into all healthy living, we'll be in a better place.
I love hearing that normalized healthy living. That's something that, I mean, I wish that we could shift the focus to that and stress that more so than people are, like we talked about vaccine fatigue, and people are, kind of tired of hearing about vaccines, but you don't stop treating the underlying illnesses that you have. You don't take your blood pressure medicine for a year and then just quit. You're going to see ramifications of that if you do that. So it's the same with vaccination and remaining healthy, staying up to date on eligible vaccines. The viruses are nasty viruses, and they change every year, and they cause people to be really sick. We may not have a really bad flu season this year, but if people stop getting vaccinated for the flu, and in a few years we do have a really bad flu season, that's going to have a tremendous impact on our healthcare system and on people really getting sick and becoming hospitalized. So we should not take a break. The viruses don't take a break, and we treat our other chronic illnesses all the time. And we should do the same with making sure we're staying up to date with eligible vaccines.
Well, as we say in the community, that'll preach. So what you said, Dr. James, really is important. And absolutely thank you for catching that, Julie. It's saying, really, we're normalizing the disease and not normalizing healthy living. Mm-hmm. We really need to flip the script on that in a very significant way. If we're trying to, get healthy and remain healthy, we have to normalize healthy living in a big, big way. And that it goes to diet too. And I know that's a 4-letter word when we're talking to folks, but we have to talk about that as well. So I'm going to ask a hard question. And the hardest questions to always answer is why, right? And so why is something we always try to avoid, particularly when I was counseling. I would try to avoid why. It was always what, how, things like that, things that they could quantify. But why gets into reasoning and judgment, all these different, it's got all these layers. But I'm going to try and ask this question. Dr. Brooks, why do you think vaccine uptake is lower amongst the Black community? And what are some steps, some things that we can do to increase the vaccine uptake in our community?
Well, the vaccine uptake for influenza is much lower. I think it's 54% for African Americans, like 70% for whites. COVID is 78% for whites and 70% for Blacks. So Blacks have really caught up. And the studies also out of the Kaiser Family Foundation show that Black folks are more worried about getting COVID and getting sick from it than all other groups. So it's like we finally kind of figured it out that this thing is real, COVID. And we are at high risk, and so we better get vaccinated, take care of ourselves. It really is. It's mistrust,
yeah,
and it's hesitancy, and then there's some complacency. So it is understandable that Blacks have some hesitancy due to mistrust of the healthcare system. There were grave robbers that came to the South and hit the enslaved graveyards and took the bodies to the northern medical schools. The experimental U.S. public health system at the University in Alabama, we don't even like to say, I want people to understand, we now don't say the blank experiment because it puts a negative connotation on that school in Alabama. It's a U.S. public health system experiment. They were sterilizing Black women. I mean, it goes on and on. So that is a major reason why. But there's another one, and it's really important, and it was touched on by one of the panelists, and that is the basic access. We are less like people are less likely to, the less likely you are to be insured, the less likely you are to get vaccinated. You don't have your own family doctor, you're not as likely to get vaccinated. If you don't have transportation, you're not as likely to get vaccinated. So it's complex, and others will have additional reasons in terms of why they see it this way. But it boils down to social determinants of health, mistrust of the medical industry, if you will, healthcare industry, and other areas. I'd like other people to comment on that because they know, just like I do.
Well, Julie, go ahead, Dr. Hagan.
Well,
no, go ahead.
Well, I just wanted to second even prepping for this call, was looking at the data on vaccination, and amongst older adults for COVID-19, Blacks even last year were on par with their white co-citizens at about 38% vaccination last year, which was an overall kind of low vaccination year. So I do want to say that we're not always lower, and congratulations if you are on this call and you've been vaccinated and you take this seriously. We do want to acknowledge that, right? And I also want to reiterate, there are definitely places where we are frequently lower. Influenza is one of them. Pregnant people is another one. And so those are two huge gaps. And I know influenza, honestly, like every year I have to try to talk my mom into it. And she feels like the vaccine gives her influenza. So she doesn't want to take the vaccine because she feels like it gives her influenza anyway. So, there's this constant re-education as well of making sure that we're equipped with the right information, that your body having some fatigue or a low-grade fever is your body working to get a good immune response to protect you from a disease that could be fatal, and that is not in and of itself dangerous. That's just your body working itself up to protect yourself. So I think there's some of those kind of misconceptions that I assume are prevalent in others in the Black community as well, and we kind of need to keep working on those. Some of those perceptions as well. And then for pregnant people, I can't speak to everything, but I think, sometimes people are cautious and want to make sure they protect their baby, and they don't always realize, because they don't see the illnesses all the times that are, used to take away lots of young children under 5, that passing on that immunization to your baby is the way to protect it, that the baby can't do that themselves in those first 6 months. So I think there's a lot of places where, people want to do the right thing to protect themselves and their family, and we just have to keep giving the tools for them to be able to do that.
And to add to that, Dr. Hagan, you mentioned about maternal immunization, and I have to say the work that we've seen by ACOG, the OB gynecologists in the last 10 years, and the toolkits that they've developed to help increase those rates, not just for influenza, but for other vaccines as well, for pregnant women. I think that's something to commend. Do we still have work to do? Absolutely. We still have to get that message out. But I always get excited when I go to my OBGYN and they offer my flu shot for the year. I'm like, yeah, that's working. That's great. And that's what we want to see. So I think, to the point about why those rates are low, I think, to those that are listening to this program, I reiterate and say again, too, as one of the panelists said, kudos, because I think now you become a messenger in your community and in your local community, in your churches or in your social circles. Hey, I heard this and these benefits of vaccination, and did you know? And I think those types of conversations can go just as far as the negative conversations. Oh, I got my COVID shot and my arm hurt for 3 days. We've got to spread that positive message there and let that go out into the communities. Mm-hmm. Oh, I didn't get flu this season, and grandma stayed protected when I saw her for Christmas. Those are the types of messages we need to be communicating. And yes, we have trusted messengers at the medical level, but I think we all have a bit of responsibility of being a trusted messenger. And I would charge those that are listening to also become that messenger in your social circle and communities.
I could not agree more with that. I love that bringing up that trusted voices are not just your providers, your medical providers, your pharmacists, your doctors, that there's people you look up to in your family, or a friend that you is a trusted voice for a lot of things in your life. And so you can be that person for your family, or get that information from someone else that is now, kind of taking the banner and realize that they have made themselves more happy and others around them, or made themselves more healthy and others around them more healthy by being vaccinated. So it doesn't have to be a medical provider.
Yeah, my marketing brain started going, and I was like, pain is temporary, long COVID is forever. So what is
That's right.
which one do you want? So Julie, you're making a great point, and talk about the role that because not every community, particularly communities of color, has a hospital there readily available for them, and so that's one of those things that shows a healthy community. It's got a hospital, it's got a grocery store, fresh food, things of those things, a bank, things that are really signifying a healthy community. So what role does pharmacies like Walgreens play in filling that gap where communities might not have a hospital, might not have an urgent care, but they've got a Walgreens where they can go and fill in that gap for some of these, particularly during respiratory season?
Sure. Yeah, absolutely. I think you're hitting on, something that's really important, and that is that a lot of individuals, live in an area that's medically underserved. And I mean, a lot of us, because there's a healthcare provider shortage, and so it's difficult to get into those providers. But nearly 90% of the U.S. population lives within 5 miles of a pharmacy, and they can speak to their pharmacist anytime. We're very, very accessible healthcare providers and can answer questions and educate about vaccines. I mean, yes, we want to get as many folks vaccinated and up to date on all their eligible vaccinations, but we know that people have questions, and you can walk into a pharmacy at, outside of business hours and talk to someone and try to learn a little bit more about the vaccinations to decrease that hesitancy and increase vaccine confidence. Not only are the pharmacist providers there available in the stores, but we still do a lot of vaccinations throughout the community with community organizations and partners, including long-term care facilities, employer groups, and a lot of community advocates and civic organizations. Churches are one of the main organizations that we still work with, began, even prior to the pandemic, but throughout the COVID pandemic, really connecting well with our faith leaders to work with them and use their trusted voice with their congregants to have their own events in their own building. So our pharmacists will come out and do a educational event sometimes prior to these vaccination events, or come out to do just a vaccination event, whatever is needed by that particular organization. So we're really proud that we continue to do that and have held about 300,000 clinics over the last few years outside of our walls.
Alice, you brought that point up. That was one thing I wanted to underscore. One of these two pharmacists on the call have the data, but I want to say 80%, some huge percentage of the vaccines are being administered in the pharmacy. I can't remember last time I didn't get. I think I got all of my COVIDs except the very first one, which I got in the hospital. I got at the pharmacy. And it's so everyone, I mean, most people have one medicine, or the pharmacy is inside of a grocery store. So, I mean, you're walking right by. It's like, okay, I got mine. My wife said, why'd you do that? I said, because I was there. You asked me to go to the market.
The number one driver, convenience.
And so she went the next day, and it's just so easy. And so that has been a game changer in terms of controlling respiratory illnesses, in terms of getting people vaccinated. Again, I'm sure that the pharmacists have some data, somebody does, but I know that I saw it, and the number is just huge in terms of the number of vaccines administered in pharmacies.
And Julie, I like the fact that you said that the pharmacists actually have gone to the different churches and other avenues to provide the vaccine, because for those who don't have the transportation, or the healthier individuals who don't have that medication in the pharmacy that they're picking up, going to the churches, having the events in the communities, bringing it to them. Talk about convenience. I think is super important for the community so that they are not only educated, but they have the access right there, so that they can get vaccinated. I think that's huge. Being able to do the community outreach and bring the vaccines to the community is so important.
Well, it also brings a face to it. You know, you're interacting with people directly, talking to them, gaining trust, answering ththose questions that they've had a lot of questions. They just didn't have someone to ask. So making them have that higher comfort level and confidence in vaccines.
And I just say that my personal experience of bringing my 92-year-old mother to get her vaccines at the pharmacy, and as much as I would love for her to just believe that I have the best intentions, she questioned everything that I said and asked Dr. Caldwell, pharmacist, who really took the time to explain. And that's where it really hit home. If you've got concerns, if you've got questions, ask them. Ask them to your trusted messenger, who's your healthcare provider. In most cases, it's going to be your pharmacist, who is more than happy to take the time and answer them and put it into context. But the other piece, and I think Dr. Ambrose said it really well, is that we all of us have a role to play as the trusted messenger in raising that voice to get vaccinated, to bring healthcare prevention to our loved ones, and be the catalyst for them to ask questions further if they have with their healthcare professionals. We're all in it. We all have skin in the game, and we all have a role to play.
Yeah, and Dr. Massey, to add to that, I mean, my 78-year-old mother, we go through this every season, and now I'm on. I speak with her pharmacist on the phone every year on what we're going to get, and so I think she would have it. So I commend the pharmacist, and you know, this is in the Mississippi Delta. That's a little bit more rural area, and so for the pharmacist there to take the time to talk to me on what they get, I think that's commendable and really highlights the huge role that they play in vaccinating and kind of helping that barrier of access for Black communities.
Well, I would say in the macro sense, we're talking about health literacy, right? In terms of being able to understand what it is that will maximize your health. In a micro sense, I'm going to say what y'all can't say because y'all are all healthcare providers. Is folks, you are the number one driver of your health. The people on this call are going to give you advice, and they're giving great advice, but you are the number one driver. Everything you do is your health should be number one, because you can't do any of the other things in your life if you're not healthy. And that is your primary responsibility, is taking care of your health first. And in leveraging the people that are on this call, the people that are in your community, at your local pharmacy, if they come to a church event, all of those things, leveraging that to improve your health literacy. But you've got to be the number one driver of that, because you're with yourself every day. So that's my PSA. I'm gonna get off my soapbox. I put it off to the side. I might pull it out again later, but I had to go ahead and get that out, because I do think it's important. Every time we put something in our mouth, we're making a health decision. And we have to recognize that every day. Every time we don't get vaccinated, we're making a decision about our health.
And can I just add, I really like the word leveraging that you used. I will say, you know, when I mostly take care of pediatric patients now, but I trained in adult medicine as well. And when I took care of adults, especially adults that didn't trust the health system, that was really always my message: is you're in this health system, what can it do for you? And you should be able to take advantage of what it can do for you. So, you know, I had plenty of patients who came in like, didn't trust this person or wasn't sure about this person. And my message was always, but what can it do for you? What do you need out of it? And so I really appreciate that word, because we do have all of these resources in this country, and some people are accessing them and some people aren't. And we should be demanding them for us and for our health and for our loved ones. So.
And if I may briefly add, because Ellis, that was important what you said, and someone else also said wellness. But we are in a situation where we were in some group, and the question was, what's most important to you between family, health, and work? And people debated family versus health, 1-2-1-2, but work was always the end. And then the question was, where do you spend most of your time? Family, health, or work? Everyone had work as the number one place where they spent the most of their time. So people do not, and this just our nature, we don't spend as much time taking care of ourselves as we do working. And the work is what's making our health worse a lot of times. So we need to sometimes just rethink how we approach, almost I want to say life.
Yeah.
But like this, I mean, look at your health. Like you said, there's the number one driver. So take an extra 10 minutes a day for your health, whatever that might be. It might be reading, it might be exercising, it might be interacting with other people. But take your health seriously. You're right. You're the driver.
That's such a valuable one-liner right there. Just you're the driver, and you spend more time with yourself, and you're the one that's going to reap the benefits or the complications of making those decisions. So,
Right.
And I feel like sometimes too, we're in a much better position now with the availability of vaccines, perhaps than we were 20 years ago. I can remember a time when, the flu summit was kind of born out of, were we going to have enough supply of influenza vaccines? And that was probably 20, or so years ago when that happened. That's not an issue now. We have vaccines available. We have newer technologies that are available for some of these diseases. And RSV, how many times did I hear at an ACIP meeting, this is what we needed. This was an unmet need. Now we have an RSV vaccine, not just for infants, which was always the conversation, but for older adults as well. And the CDC has recommended that. We had a public health crisis 4 years ago, and we had companies that stepped in and was able to get a vaccine out, working with government, working with the public health officials, and they were able to get out a COVID-19 vaccine and to prevent deaths, right? And sometimes that's viewed as bad. And when I talk to people, I'm like, that is technology and science at its best, and collaboration at its best. We should be excited and shaking a pom-pom for that. As a former cheerleader in high school, pom-pom for that. But instead it was also viewed as came with a lot of skepticism. And that's where we communicate. Influenza vaccines have been around for the longest, right? But we have new technologies now. We have adjuvanted vaccines and vaccines with a higher antigen content that were specifically designed for older adults, that were specifically designed to address the natural process that happens in us with our immune system. As we age, so does our immune system. It doesn't work as well. And now we have vaccines that address that. The CDC tracks their effectiveness. Others, they work. And so now we see that, and the CDC preferentially recommends those vaccines for older adults. We don't have an excuse. 6 months and older, there are numerous vaccines available for influenza in that age group, and the vaccines that are available for COVID-19 and RSV. It's there, and we just have to be able to communicate that and let people know this is a great thing, and it's a great position for us to be in at this time.
Absolutely. And most of the time you can get all of those eligible vaccines at one time. If you
Yes,
can,
yes.
you can do them. They almost all can be co-administered together. So
So
we
let
have
me
to
ask,
take the time. Take 10 minutes, like Dr. Brooks said.
yeah, on your way to get some eggs, go and get shot, and walk right. It's in the grocery store. So let me ask this question for the industry folks. Which of the respiratory illnesses does your particular company have vaccines for? And I'm going to ask an obligatory question. I know the answer, but I have to ask this because people ask this all the time, even to this day. Are they safe? So who wants to start? James, you want to start? What vaccines does Moderna have available for people to take advantage of?
Certainly, Alice. Thank you. So Moderna, obviously, as most people know, we have our COVID-19 vaccine that's updated every year. To Dr. Ambrose's point, when you think about it, when did we were told or we were informed of what variants to include? What is this updated COVID vaccine? It was in June, mid-June. And by the beginning and mid-August, by the start of the respiratory season, we were able to supply and have a updated COVID vaccine for the most prevalent circulating variants in the United States and globally. That's remarkable. That's absolutely remarkable. But vaccines are only as good as if they get into the arm. So that's my PSA for the moment. So we have our updated COVID vaccine. We've got our RSV vaccine for adults, years and above. And we are currently working on a combination COVID and influenza vaccine for the point of from a pragmatic, practical perspective. You show up and you can get both your COVID and your influenza vaccine in one combination vaccine. That isn't 3 years away, it's 2 years away. It's within the next year and a half that we should be seeing that vaccine come to fruition. Now, to your point about, are these vaccines safe? Well, I punt that question back to the CDC, and they do a wonderful role in terms of evaluating the safety. And my goodness, Dr. Brooks, I don't envy the amount of work that you have to do and your colleagues on the ACIP of looking at both the safety, the effectiveness, and in that benefit risk. So does the benefit of receiving the approved vaccines, for which they have to go through the standard gamut, really rigorous evaluation on the safety, on the efficacy from the FDA to gain that licensure, but then the CDC has to come in and say, well, how do we implement? What's our recommendations? And they weigh the benefit risk. And undoubtedly, there are the benefits of vaccination, of these vaccines, greatly outweigh the risks that come from it. So in that regard, this is the vaccines that we have, COVID, RSV. We're working on a combination vaccine. And the best way to stay healthy is to stay up to date with your vaccines.
So, Justine, Sanofi, what do you have available?
So for Sanofi, we have several different influenza vaccines. As Dr. Ambrose mentioned before, we have one of the differentiated vaccines for the older adults, so those 65 and older. We do have the high dose influenza vaccine. We also have the recombinant influenza vaccines available. And then for the younger population, we also have our standard dose influenza vaccines available as well. And for RSV, we have the recently approved monoclonal antibody, the immunization for RSV for infants. So all of the infants that are less than 8 months of age who are going into their first RSV season, they're eligible to receive the nirsevimab. And for those individuals or those infants who are going into their second season who are considered high risk, so for example, those with the congenital heart disease, the chronic lung disease, the immunocompromised patients, the American Indian, those of Alaskan Native, they're considered higher risk going into their second season, would also be available to take the second dose or a dose during their second season. And speaking of COVID and combination vaccines with influenza, Sanofi is also working on a combination vaccine that would include the COVID vaccine as well as the influenza vaccine. So more to come on that, but that is on the docket to come as well. And again, just to go off of what James said regarding the ACIP and being able to evaluate the information that's available, all of the studies that have been done for all of the different vaccines that we have. Again, just the same, I don't envy what you do there, but there's a lot of information or lots of clinical studies that are being done to evaluate the efficacy, to evaluate the effectiveness of the vaccine. Lots of real world information, real world data that is coming out, especially for the RSV immunization that we have. So there's lots of information. It's just a matter of sifting through. And I know there's a lot of misinformation that's out in the community that is trying to counter all of the work that is being done, all of the studies that have been conducted for all of the vaccines. So it's a matter of just sifting through the data and evaluating what is real information versus the fake information. And I think the CDC and ACIP really does a great job in sifting through all of that information.
I'm just going to give a good kind of line of delineation. If it's a guy sitting in his bathroom, in his car, or in his basement, I would suffice to say the device may not be the best and the most secure. So find it from people on this call and others like people on this call to get your health related data. That dude can help you get to the next level on your video game, but I need you to talk to real professionals. And I'm going to say it because I can stand. I'm standing in the gap. People can get mad at me, but I'm going to say it out loud. Please use a trusted and reliable source. I'm joking, but I'm partly serious.
Right. Please, let me add something to that discussion real briefly. When the COVID-19 vaccines came out, right before in December-ish, of 2020, we met with both Pfizer and Moderna, National Medical Association.
Mm-hmm.
Both of those vaccines had somewhere around 12 to 15% African Americans in the studies also. Yeah. So we were in the studies. We said, we're hearing that there's issues from the community, that maybe there's infertility. The vaccine, there are certain lots of it. They were for the Black community that weren't, safe. And they looked at us and they answered everything we wanted to. And we put out a statement saying that the NMA stands by the COVID-19 vaccines because we looked at the data. So for the African-American community that may have still these misgivings, like, are they safe? They're safe. Now let's move on. We talk about we need to re-normalize vaccinations. I don't need all these questions, but if I thought there was something wrong with it, I would not be giving it to you. So, you can ask the questions, I understand, but we have to understand that we got to that place because of a whole lot of mistrust, misinformation, hesitancy that was kind of misdirected. But we got to grow up now, okay? Look, the vaccines are safe and effective. RSV kills, COVID kills, influenza kills, maims, puts you in the hospital, does everything bad you can think of. So let's just vaccinate, and then you go out there, and eat hamburgers and French fries, and don't put on your seatbelt. So I just try to be very straightforward with people.
I love it.
Yeah, and I like to remind people sometimes that so the system works. There was a vaccine during the pandemic where eventually we decided the risk outweighed the benefit and it got pulled. So it's not like every vaccine we're pushing. There is a annual review to actually 3 times a year that Dr. Brooks knows with ACIP, sit down and review of data. But before any decision is made, all of the safety data, all of the effectiveness data is reviewed. Currently, as of this past year, it still COVID-19 vaccines, influenza vaccines are thought to reduce about half of the risk of hospitalization. And for RSV, it doesn't change as quickly as COVID and influenza. And so it is even more effective. It's about 80%. And so those work, and the safety, mostly you're going to get soreness, as we were mentioning, maybe some flu-like symptoms that are temporary. All the other side effects that are, have any greater risk are very rare, and we monitor them. And these are the most monitored vaccines in history because they're decided on every year. And so we do want to encourage people that the system is working.
Dr. Ambrose, I wanted to give you an opportunity to speak about what your organization is doing, what vaccines you have available, and I think we've sufficiently covered that. Are they safe?
I think you're right, and I would just say, as I tell my friends and family members, that as safety is always the first priority for any vaccine trial. That we first have to establish safety before that vaccine even moves forward. And so I think we in addition to the methods that the CDC used, the companies also have a whole division that focuses on the safety of vaccines and taking anything that comes in and looking at that and going through the proper the protocol for that, to if there's a signal of any sort. So the CDC doesn't want any unsafe vaccines, and the companies, we don't want any unsafe vaccines out there as well. With regards to CSL Secures, we do have 2 differentiated influenza vaccines, one of which is the adjuvanted influenza vaccine that's been designed for older adults. And so, we're very glad that technology, in addition to the high dose vaccine for Sanofi, has come to market, and we have both those vaccines available for that population. We also have another differentiated vaccine for 6 months and up, and that's the flu vaccine that's built off our cell-based technology. So this particular vaccine is not made in eggs; it is made in a mammalian cell line. And so we're excited at that. We're looking at combining that technology for standard influenza vaccines or for just seasonal influenza vaccines, excuse me. But we do have that technology that is licensed for the pandemic, the H5 pandemic vaccine here in the U.S. As for countermeasures in the event of an avian influenza pandemic. So it has gone through safety and efficacy studies as well, and is ready to go in the event that should happen. But for our seasonal vaccines, we have that, and we also still have a standard egg-based vaccines that's also licensed for 6 months and up. They're safe. They are effective. We monitor. So I have to say that everyone else said it too. So
So we are nearing the end of our time. This has been a fantastic hour, or just short of an hour. As we're coming to our close, as we say in the church, we're going to hurry up to our close. We're going to go around the room. So if there's something that you wanted to say but didn't get a chance to say, now is the time. Or if there's something that you already said but you want to reiterate so people can really take that message home with them, now is the time to do it. So we'll start with you, Julie.
Thank you. Well, first of all, thanks for inviting Walgreens to participate. I'm really happy I got to talk to you guys tonight. I would just like to say that it's now is the time, and we're heading into the holiday season. It takes about 2 weeks for vaccination immunity to be fully present. So now is the time to go in, have your pharmacist take a look at what you're eligible for and get each of those vaccines in one visit, and you'll be good to go for the holiday season.
Fantastic. Brother James.
Thanks, Ellen. I'm going to say it again. We've got to normalize healthy living, in which vaccines and vaccination is one critical component. And if you've got a question, go to your trusted messenger. That can be your healthcare provider at all levels, from your physician to pharmacist to the nurse practitioner. If you've got a question, just ask and they won't answer. But normalize healthy living, normalize bringing vaccines into all of this, and stay safe for the holidays for yourself and your loved ones. Thank you.
Ms. Josephine.
Yes, absolutely. Thank you for having me. I would like to say to the audience, get educated. Use your resources. Go to your pharmacist. Go to your local resources to get the information that you need about the vaccines. Vaccines work. Vaccines are safe. The common cold is out there, but these particular diseases that we're talking about with COVID, with influenza, with RSV, it is not like the common cold. For some people, it won't just go away after a few days, or drinking soup or just water or getting rest. The vaccines are there to help prevent severity, to help prevent the hospitalizations. For influenza, that's why we have the differentiated vaccines for the older adults. That is why we have the RSV vaccine now for the infants, for the older adults as well. That is why we have so many options also for COVID. They work. Get educated, reach out to your resources to get the information that you need to make the best decision. Whether you're healthy or you think you're healthy, the vaccines work. They help prevent severe diseases, even in those who are previously healthy.
All right. Captain Hagan.
I'll go quick, just two things. We didn't touch on affordability too much, so I do want to say that we know affordability isn't always straightforward and insurance isn't straightforward. There are resources. CDC's tried to post some resources on these things, but talk to your state health department if you're having trouble finding free vaccines, and also there are patient assistance programs for treatment. I do want to remind you that treatment is out there if you do happen to get infected and you are high risk. Even if you've been vaccinated, look for treatment. The last thing I want to say is thank you. Thank you so much for spending your Veterans Day evening with us, and we really hope that we've given you some information that will help you make good decisions and protect you and your family.
Absolutely, absolutely. And Dr. Ambrose.
You know, it's really hard to kind of go towards the end when everyone else has gone and said so many profound things. But I think of a story a few years ago. I had someone that was an anti-vacciner come up to me in the airport, and they had their spill, and they were very passionate about being anti-vaccines. And I had one simple message that I said to this young lady, and it's vaccines saves lives. They save lives. And there's data to show it. There's no arguing with that. The data is there. The resources are there that shows that. And so get vaccinated because it may save your life. And I think it's just as simple as that.
And of course, last but certainly not least, Dr. Brooks.
Well, thank you, Ellis, and thank you, BDO. I would say that getting vaccinated is not just a personal action, but is a community action. You getting yourself vaccinated, not only does it reduce your chances of dying, getting hospitalized, being sick, but it reduces your chance of spreading this to other people. So understand that only when a community gets together and is strong and works together toward a common goal, which is overall good health for the community, will it really have that macro effect. So just remember, when you're getting yourself vaccinated, you're not doing it just for yourself, but you're doing it for your family and for your community. And that's not just the Black community, but we need to look at that. But that's for the whole community.
Amen to that. So as we are wrapping up, I want to thank our partners at Bio for putting together this fantastic panel. I thank you all for suffering through my jokes and through some of my musings through this conversation. But I'm going to end with this, and it's a personal story. I had a family member, a young lady. She was part of a twin. Her and her brother were twins, and they were in their 20s, early 20s. Younger people during the height of the COVID pandemic typically felt like they were going to survive. She did not. So we lost a family member. He lost his twin sister because she was unvaccinated. And that was a very real thing. It was very hurtful for me and my family to go through that. It was very unexpected. And so you don't want to be on the other side of that. No one wants to be on the other side of that. So throughout all the tough love we gave you tonight, through all the fun and all the information that we gave you this evening, please remember that vaccines do save lives. Please get yourself vaccinated first, and then encourage people in your family and in your circle to go get vaccinated during this respiratory season. We thank you for your time and for your attention this evening, and we look forward to seeing you again here on blackdoctor.org.